In this Year of Sustainability, Today for Tomorrow, Fatima Healthcare Group salutes the UAE leaders for their visionary approach to sustainability. The United Arab Emirates is one of the leading nations in the world. Recent statistics confirm that the UAE has become a globally prominent financial and economic centre. Similar growth has been experienced in healthcare. Fatima Healthcare Group extended enormous services to the society, especially in healthcare, for the past 25 years. 40 years ago, the provision of healthcare services was limited, and hospital care was almost non-existent. In recent years, the government has developed an extensive network of multidisciplinary hospitals and clinics all over the country. With the development of this sector, infant mortality rates have dropped significantly, childbirth mortality rates are at zero, and the population now enjoys a considerably higher life expectancy. The long-term planning of our visionary leaders have allowed many of us to live enjoyable, successful lives. Fatima Healthcare Group, a conglomeration of multiple entities incorporated locally and internationally, provides healthcare services, establishment of non-profit organizations, and philanthropic contributions to the society. The success story of Fatima Healthcare Group relates back to the early 1990s, wherein Dr. K.P. Hussain, chairman of the group, a medical practitioner by profession and a profound thinker, with his keen-sighted vision to create a process or service that introduces a new development in the field of medicine or healthcare industry. Fatima Healthcare Group was founded in 1997 by Dr. K.P. Hussain, who opened the group's first clinic. Over time, Dr. Hussain established many clinics, polyclinics, pharmacies, and diagnostic centres, successfully serving the needs of the population. The desire to provide medical security meant that the market needed more clinics, and Fatima Healthcare Group collaborated with the Dubai Health Authority to identify developing areas that needed more healthcare-oriented support geographically. Fatima Healthcare Group joined hands with the Dubai Health Authority to identify suitable geographical locations and to create healthcare facilities. Dr. Hussain perceived that due to the nation's large expat population, more healthcare facilities were necessitated and evolved to establish more facilities. Dr. Hussain also supported the corporates by providing camp clinics and was instrumental in bringing eminent doctors and intellectuals to the UAE. These continuing medical education programs, CME, enabled well-known doctors from all around the world to come and impart their knowledge to the medical fraternity and patients. Many high-profile doctors attended these CMEs, including Dr. K.K. Ramalingam, commonly known as the father of modern ear surgery in India, and a much sought-after teacher and mentor to ENT surgeons. And Dr. K.M. Cherian is a world-renowned and distinguished cardiac surgeon. Overall, Fatima Healthcare Group carried out over 150 CMEs, and would later be appreciated by the government, who often attended the events. The success of the program benefited the medical fraternity largely and was very successful due to the government support during the first decade of Fatima Healthcare Group's initiatives. Early in his career, Dr. Hussain, a voracious reader, would imbibe knowledge and progress of the nation's developments by reading the rulers' messages in the newspapers. During this time, he noticed the massive changes the UAE was undergoing, with numerous projects announced. In his mind, he wanted to grow along with the country and serve society in the best way he could. In 1992, he had an opportunity to be involved in the preparation regarding the Dubai Quality Award, where he was able to discuss with leading figures in various industries. During these discussions, Dr. Hussain understood the direction of the nation more clearly and could identify the upward trajectory the country was on. As expatriates began to reach in large numbers, the UAE's population increased tremendously and the need for medical security became a great challenge. At the turn of the millennium, Dr. Hussein proposed a model that provided this growing population with support and started working on a health maintenance organization, HMO. During the period 2000 to 2004, the doctor researched on the National Health Medical Security model in the US and UK, whilst surveying the current situation in the UAE, to blend together a solution that would be successful. Extensive research and development were carried out, and whilst the doctor was still practicing, he found a solution. The solution would provide the low salary band, LSB, segment protection and remedial problems faced by them, including high-cost treatment, medication, consultation and general accessibility. After presenting his findings to the Dubai Health Authority, DHA, and the Department of Health, DOH, Dr. Hussein met corporate government organizations and provided them medical insurance cards that allowed treatment for cardholders at around 65 medical institutions run by private healthcare facilities, who agreed to extend support to Dr. Hussein's concept for the betterment of the people at that point of time. Eventually, Dr. Hussein witnessed the success of this venture and realized that it was viable on a larger scale. Based on his research and as an outcome of the research, Dr. Hussein developed a concept in the year 2004: cost-effective, comprehensive, affordable healthcare for all. And his concept, with an idea of paying a low premium by corporates for blue-collar workers, assuring medical security. FMC Network UAE began to present this scheme to the insurance companies to impart a concept of serving their blue-collar communities with low premiums. The scheme was accepted, and initially 5 major insurers began to work with FMC, although Dr. Hussein's innovation and recommendation was not experienced in the UAE by any insurance companies. The 65 medical service providers that FMC started with initially now exceeds over 3,500 providers. Initially, some of the government institutions supported FMC for implementing the concept to move forward by initially managing outpatient services and over a period of time, inpatient services. In 2006, the scheme had around 100,000 members with over 200 corporate companies, bringing FMC more success. During 2005, the Emirate of Abu Dhabi mandated health insurance scheme compulsory, and many international organizations, including insurance companies and reinsurance, had approached Dr. Hussein to understand the secret to his scheme's success and how they could replicate it. Dr. Hussein's vision for a greater reach on the well-accepted concept shared his data analytics and findings to them, and later to the Dubai Health Authority. During the year 2014, his healthcare management presented the findings, data and research of the last 6 years to the DHA, backed by Lloyd's London and Taha Actuaries. Thereafter, discussions continued between Dr. Hussein and the health authorities before the formation of compulsory medical insurance in Dubai. FMC was able to successfully reiterate that the concept of a low premium being used to provide security was viable, and in 2014, the DHA awarded FMC a special appreciation for the work undertaken during that time. FMC is rightfully viewed as one of the pioneers and pillars when it comes to the formation of the compulsory insurance scheme, with the group's research and development playing a vital role.
The UAE and the Emirate of Dubai have one of the most advanced health insurance systems in the world. And in Dubai, as we were designing that model, the credit really goes to the government of Dubai in supporting the Emirate of Dubai to design that amazing health insurance system. And for sure, one of those stakeholders is FMC Group and Dr. Hussein, who has been truly passionate about health insurance and has played an instrumental role, as well as other stakeholders, in helping to design and implement successfully the health insurance system for the Emirate of Dubai. It's my absolute pleasure to congratulate FMC Group and Dr. Hussein on the strive they have been making in delivering good quality, affordable healthcare to the population of the UAE and the Emirate of Dubai. And it's truly remarkable to see the achievements over the last 25 years and how much they've done for the Emirate of Dubai. I'm also aware that they're launching their first care scheme right now for higher insurance packages, and I wish them all the success with that. This journey has not been complete without the participation of partners like FMC Group and Dr. Hussein, so I really wish them all the best for the future.
The association that FMC have with their insurance companies, service providers, corporates and cardholders is the reason behind their success. FMC is blessed and thankful to be in the UAE and grateful for the immense support from the authorities.
I would like to congratulate you, Dr. Hussein, for 25 years of success. Actually, I know FMC since beginning. They have done a great job in the market. They have come with a new technology, with new ideas, and it's one of the best company we are dealing with these times. The company started with a strange concept to the market, with a new concept to the market, let me say it in this way. The concept was accepted at that time and was one of the best solution for the low category plans, and LAN has done a great job to satisfy the members at lower category. And this is due to the innovation, let me say, in the ideas and in the technology used by FMC. So I take this opportunity again to say, Dr. Hussein, go ahead, continue with your development and your strategy and your plans, and we will continue to support you for the same. Assalamu alaikum.
Today, Dr. Hussein is overwhelmed to witness that around 9 million of the expat population is under the coverage of medical insurance security, and that he was able to be a part of this remarkable event. FMC was awarded by the Insurance Authority as the best TPA for applying financial controls. This came after FMC was audited twice in the year 2019 and 2020. The authority appreciated the company on their financial discipline, an important accolade for the group, motivating them further. Awards and recognitions. FMC was awarded the TPA of the Year 2022 and 2023 at the Middle East Insurance Awards. Honoured and awarded by World Medical Council People-Centric Entrepreneurial Award on 23rd May 2014. Honoured and awarded by Government of India, Ministry of External Affairs, as Most Iconic NRI on 20th January 2018. Decorated with Arogya Karma Shrestha Puraskar by Veer Parasi Raja Charitable Trust in the year 2011 by Shri K. Shankar Narayanan, Governor of Maharashtra, India. Doctor of Excellency Award, honoured by University of Milano, Italy, in year 2015. Honoured by Indiewood Medical Excellence Awards by World Medical Council on September 27, 2016. Awarded with Business Visionary Award, MES Alumni UAE at Sharjah from Dr. Shashi Tharoor, Member of Parliament of India, former Under-Secretary General of the United Nations for Communications and Public Information.
Myself, on behalf of NGI, I wish to congratulate FMC, Fatma Healthcare Group, on their 25th anniversary. Collaboration with FMC has enabled us to unlock tremendous potential in multiple areas of our medical operations. Their experience in handling claims and services, with a strong relationship with their medical providers, has been impressive and really exciting. For FMC and NGI, journey has been positively impacting our business. FMC was a great partner. FMC helped us to grow the medical portfolio with phenomenal results. Their partnership during the years of working together allow us to improve the medical profitability and reach new valuable clients. Dr. Hussein and his team for their new initiative to launch a new product called First Care. Congratulations. I wish all the success and prosperity to FMC of years to come.
Dr. Hussein, a social worker and a philanthropist, deserves special mention on his charitable works. Dr. Hussein is the founder of a non-profit organisation in India under the name Dr. Hussein Charitable Trust. The trust supported in donating dialysis machines to 14 district hospitals in Kerala, India, with over 65,000 people benefiting yearly. In 2012, Dr. Hussein Charitable Trust joined with Helping Hands Charitable Trust to fund life-saving heart surgeries, extending ambulance support and support to homeless by constructing 54 homes for the needy. Dr. Hussein also supported ambulance units to work for early kidney detection units to make preventive camps. These initiatives have helped the people save around 100 crores by doing 600 camps in India. In 2018, Dr. Hussein travelled to Kerala during the flood calamity to witness personally the catastrophe and to help those affected personally. He arranged relief camps, food supplies, and coordinated with thousands of volunteers to deliver support. Dr. Hussein also extended to the Kerala Chief Minister financial support to help deal with the disaster. Dr. Hussein extends educational support to those unable to pay fees and supports people of determination with the sponsoring of 2 dedicated facilities along with many other charitable initiatives. Dr. Hussein is enormously thankful to Allah and grateful to his social partners and community that have created a platform to make this happen.
Our friend Dr. KP Hussain, who has meaningfully contributed 25 years in the healthcare industry of UAE. Amongst few people in the healthcare industry who has really contributed in terms of providing access to quality healthcare to value segment. Value segment means the segment of society which did not have access to healthcare. When I came here 25 years ago, I saw him running the clinic in Dera, and which was also positioned in providing access to care to this segment of society. I have seen him grow and his contribution in developing and helping the country in developing the value segment policies. So the policies which we see today now, which are meant for that segment of society, Dr. KP Hussain has played a very important role. The entire healthcare industry and community in UAE actually recognize his contribution towards this community and society. Now I'm very happy that he is launching a new concept for the premium segment of society, which is called First Care. So I would like once again to congratulate Dr. KP Hussain on his contribution, and we all recognize his contribution to the healthcare industry. Wish you good luck, Dr. Hussain.
At this juncture, Dr. Hussain thanks the visionary rulers of the UAE, insurance companies, corporates, and the medical fraternity who have enabled these endeavours. FMC Network UAE combined with the UAE government at a challenging time during the COVID-19 pandemic. Dr. Hussain, in the UAE for over 32 years, experienced many ups and downs, but none quite as threatening as COVID. The medical industry as a collective all looked to help, whilst this virus took away the life we knew, loved ones, and left lasting damage both physically and mentally. Whilst COVID was at its peak, FMC, in coordination with the DHA, supported a 450-bed government facility, and saw firsthand how the government effectively dealt with the worst pandemic of our lifetime. FMC was appreciated by the DHA for its work, a source of immense pride for the company. FMC also provided travel amnesty support to many and repatriated stranded residents whilst providing support services in India in association with the Indian consulate in Dubai. Dr. Hussain bestows the credit to his team members and their willingness to keep giving the best possible for the organisation that had led to the 25 years of success, emphasising that FMC's success isn't a one-man show, but a team effort. It is a result of a lot of hard work from many FMC members throughout the years. The FMC journey has been a joyful one, with the only vision being to serve people. FMC prides itself on being a family organisation, with a packed calendar ensuring lots of events and gatherings for team members. The company emphasises celebrating its success as the teamwork which helps to drive the organisation forward. Without the team, the concept and the vision, Dr. Hussain's dream wouldn't have been a reality today. Dr. Hussain holds key positions in medical and educational institutions in Kerala, the Tirur Cooperative Hospital, the Horizon School, to name a few. In addition to the diverse projects wherein he is closely associated, his upcoming flagship project in Kerala, Dr. Hussain City, is set over 65 acres of land and when complete will encompass one hospital, 2 educational institutions, a shopping mall, convention centre, a Roman theatre, Ayurveda hospital and villa resorts, estimated at around rupees 500 crores at first phase.
I wish to thank everyone. Allah blessed me, and when Allah blessed me, the purpose of my visit to this country is I have achieved already. When I say achieved, it's really, I want to tell you that every best possible in my surroundings and supported me. So that if I say that I achieved and I could able to deliver something to my family and society, so where I feel my purpose of coming over this country is achieved. We wish to go further. We wish to go further the best height. And like 25 years, when we celebrate this, we see that 30th year, you all will be joining in a much more than what we have done. So when Allah blessed me, I just wanted to say that, all you, it's the great nation of this country and especially the rulers of this country. And my wish, whoever it is accepted, insurance company as well as the authority, whoever it is guided me, and their guidelines is really, really helped me, so that I could showcase my vision and innovation. I thank every one of you, and I also thank the doctors, paramedics, and owners of the hospital who supported me and served this society. Today, everyone is secured. This is my purpose. That is the reason I have come to this country. Alhamdulillah. Alhamdulillah. Thank you. Thank you very much.
We congratulate Dr. K.P. Hussain on his achievements and leadership that we are witnessing today. May the Almighty shower blessings upon him and his family, and we wish continued success for many more years to come.